Right now I am representing with this is a healthy hand, right? For example, right now, and with AIDS or HIV, some symptoms that may appear on the hand is that there's appearance and signs of fungus. According to the internet, yeah. So like the nails start in the nails, it starts to be fungus. So that's why I'm representing here with this yellow um, plastilin. So yeah, this is one of the symptoms that can happen to you by contracting AIDS. This is a commonly in the later stage of HIV patients, because of this the nails. For example, here is the fingernails, but it can be also in our feet. So yeah. So why this happens is because the body isn't able to fight the fungus because it is not in the optimal condition. So that is why this happens. And right now I'm gonna do another symptom that will happen to the hand, and that has also to do with HIV. Next we have the HIV rash, which is named like this because it appears when in the hands. For example, this is a healthy hand like mine, but when there's HIV or AIDS, some small rashes start to appear in the hand, shoulders, and back, and even in the face. But right now I'm doing it in the hand, which is the most common, and it can be non-painful or also very painful for the patients. Depends the stage it is. But something that differentiates this is that this is not transmittable. It is you cannot transmit this. So yeah, so this is one of a bad stage for you because it happens in your whole hands, and it can come into your whole body. For example, this is the very first stage, which is like small ones, but yeah, then after that, after some time with it, with not proper care, yeah, that can appear in your whole hand or even your whole body. As for right now, there isn't a treatment for HIV, but yeah, certain medications can reduce it in your body. Like, for example, in this representation that I made, it can decrease the rashes or help with the prevention of fungus underneath the nails. So yeah, but yeah, sadly, there's no cure for it yet. So yeah, there are also different stages of this, um, and also something that people have AIDS, they may not notice because it can be the virus can stay in our organism for about 10 years and not present symptoms, but we could still have AIDS without knowing. So that's one of the stage. And yeah, after that, yeah, the immune system gets worse and worse until from this healthy hand, it comes to this hand. And yeah, that is a worst stage. Well, for example, here in the fungus, it's at the worst stage, I think, for this. So yeah, it is, yeah, imperative to get checks if you don't have a regular sexual partner or anything, because AIDS cannot just be transmitted through sex, it can also be transmitted through blood transfusions. And yeah, yeah, that's very important for our healthcare.
In this part, we're going to talk about chlamydia, that is a common STD that can infect both men and women. It can cause serious permanent damage to the reproductive system. This infection can make difficult or impossible to the woman to get pregnant later. Chlamydia is spread by having sexual intercourse with another person who has chlamydia. This can happen when you have unprotected sex intercourse with someone else. If you are pregnant, you can give chlamydia to your baby during childbirth. The only way to avoid this infection is not to having sexual intercourse with STD infected person. Some symptoms of chlamydia in women are abnormal vaginal discharge and a burning sensation when urinating, as well as with men. It has a discharge from the penis and a burning sensation when urinating. There's also pain and swelling in other or both testicles. This is not that common. If we are having anal intercourse, we can have rectal pain, discharges, and bleeding. Laboratory tests can diagnose chlamydia. It can be cured with the right treatment. It is important that you take all of the medication your doctor prescribes to you. If you don't get treated soon, you can have damages like this and medication your doctor prescribes to you. If you don't get treated soon, you can have damages like this in your system. You can only have sex again if you're 100% treated. If you're not treated, you must wait months or even years. And that's all about chlamydia.
Syphilis is a sexually transmitted infection caused by a type of bacteria known as Tremonema pallidum. In syphilis, we have three steps. First, the lesion in the mouth and the pelvic zone, where we can see here beneath the lip and down the tongue, and where here's the mouth. And then we have the second step, that is the rash all over the body. Here we have an example about a hand, and here we have some wounds and the rash also that is all over the hand. It could be also in the back of the body. And then we have the third one, that is the third step, that is the a damage in the inner organs. The most common route of transmission is through the contact with the infected person, so during the sexual activity. The bacteria enters through your body, minor cuts or abrasion in your skin or mucous membranes. When diagnosed and threat its early stages, syphilis is easy to cure. Preferred treatment all stages is penicillin. Here, the penicillin could work as long as it is detected on time and you are not allergic to it. If you are allergic to it, the doctor may suggest another antibiotic or recommend penicillin distillation.
So today we're going to do genital warts. Yeah. Okay. So I watch out. There are these dark pustules in the penis or genital area. So we're going to replicate that with some strawberry jelly and some potpourri of spice like it's the dark pepper and paprika. So now I already made the model. It's the small model of a penis. We're going to do it in this area. So let's get started. I hope you can see something from here, more or less. So I'm gonna start with some jelly on the penis. Not that much. And then let it some spice in here. Not that much of jelly, just a little bit. Then let some spice in. Now we're going to replicate. Okay, so now we're going to do genital herpes. Yeah. Okay, so I watched for this. The genital herpes is pretty similar to the genital warts in terms of physically what it seems. But the genital warts is like pustules. The pustules are like more darker, and in this case they are more like white with a lot of redness. I don't know if you can see this. So I want to do this on the penis here in this part, the head. So let's get started. For this I'm going to be using red rice. I'm going to smash it and make some pustules of it, and just a little bit of the strawberry jelly so that we can use the redness from here and to paste it a little bit in the head of the penis. Okay, so I hope you can see this from here a little bit. Yeah. Well, I hope so. So first we're going to smash a little bit of rice, just a little bit. We don't need that much. Smash it, smash it. I'm gonna smash it with my own fingers. Okay. Now I'm gonna take some jelly, put it in the head of the penis, like this. Just a little bit of rice, the smashed ones. We're gonna smash it a little bit here. So we can make some pustules, some white pustules out of it. I'm gonna take the excess of jelly. Uh-huh. Okay, so we got it now. I'm gonna pause this. Something like this was my go for. Well, let me. Something like this. I don't know if you can appreciate that on camera. And this was the result. I'm gonna try to focus a little bit. What do you think? Here's the earpiece. Here's the other one, right on the head of the penis. It's right here, right here. Yeah, I hope you can see it. What do you think? I'm gonna put some photos so that you can see it. But yeah, so this was genital herpes.